Thank you to Miss Armstrong for inviting me and our organization to give me an opportunity to share about the work that we do. As you heard in my intro, um, I get to talk to a lot of people, and not just here in South Carolina, but all around the world, around the nation rather. And we've been building up this platform. And so I think that what we bring, even though I will be coming from the perspective of domestic violence, we bring a very unique perspective to domestic violence. And so um, if we are able to share our slides,
Is it letting you? Is it giving you
I
any
haven't
error message?
I haven't tried, but we will try now.
Okay, let me know.
Okay. Today, I have the pleasure of talking with each of you in about the neuroscience impact of domestic violence. Um, I, as you will learn a lot, am Dr. Juanita McDonald. I am the founder of Rediscover Me Women Initiative. I am the co-founder of Stomp Out Crime. This is our third year hosting this event. Stomp Out Crime is an initiative that is in partnership with the National Crime Victim Week that takes place every April. And so our organization, as a co-founder with three other amazing women, we put on a great event here in Columbia, South Carolina, where we are able to connect the community with nonprofits and other community leaders to find out more about those resources. Rediscover Me, as you heard from our host this morning, we train individuals on issues or we mentally elevate individuals pertaining to domestic violence, sexual assault, but we do it from a therapy perspective or from the lens of the mind and the brain. My titles consist of domestic violence advocate, and I am a comprehensive victim prevention specialist. I work with corporate leaders, faith-based communities, uh, locally and nationally, as well as the military. And so I'm also an affiliate partner with Pink Concussion. Um, this organization is one of the only organizations, nonprofit, that focuses on um, concussions that impact women. And they have a lot of massive research on it. They have been presenting and looking at changing the narrative as to what our data looks like. And I get to have firsthand information on that. And I'm able to use that within my organization as I'm working with individuals um, and groups to educate them on trauma in the brain. I am the mother of five, four daughters, one son, and I am the grandmother of 10. Excited about that. They keep me busy. I love them. Five boys and five girls. Our objective as we move forward is we're going to talk about domestic and intimate partner violence, the statistics of that. We're going to talk about the brain, its functions, and how trauma impacts both of those areas. What is trauma? Sometimes we don't quite know the impact of trauma, and so we're going to do a deep dive. Strangulation, the impact and its symptoms, and also what working with women with traumatic brain injury. So we're going to talk a lot about that as well. Um, I always put a warning in my presentations because I want you to be conscious of your own mental health. Um, as I talk, some things that I say can and will be triggering. And so, again, as always, you take care of yourself. If that means you need to turn your screen off, if you need to step away, it is okay. Do that. If you need to talk to me afterwards, I'm here. We want to make this a safe place. We're going to have open conversations. I do encourage those that are participating in open Q&A, and for all of us to be very cognitive of one another who's asking questions, who may be realizing some things that they didn't know anything about. So we want to protect one another. We want to protect the conversations, and we want to make it a safe place for each and every individual that is here. And if they should feel the need to ask certain things, and we're going to we want to open that space up for you to do that. All right. So in the chat, I want you to answer the question. This is our very first activity. First question I want to ask, and if you will just type it in, whatever your answer is, don't worry if it's the right answer, wrong answer, whatever, just answer the question, where does the brain operate mostly? Where does the brain operate mostly? If you'll put that in the chat, let us know what you think. So when we think about the brain, does it operate in the future, forward thinking? Does it operate in the past? Or is it in the present? Future, past, or present? What is your response to where does the brain operate mostly? All right. I see we're at 6 responses, 7. Uh, we got about 13 people that's putting their answer in. Where does the brain operate mostly? What do you think? In the future, in the past, or in the present? For those of you who chose the past, you are absolutely correct. For those of you who chose the past, you are absolutely correct. You're going to learn more about that as I go along. So let's get started. All right. All right. Today we're going to talk about the brain. And everything is you're going to probably get sick of hearing about the word brain, but I'm going to forewarn you because it's our center focal point. The brain, amazingly, what you are seeing here about the brain, the average weight for the brain in males is 3 pounds. For a woman, the average weight is 2.75. And so to equate what that really looks like, just think about a half a gallon of milk. When you hold your milk, if it is at a half a gallon, that's about the weight of our brain. The brain does not fully develop until um, almost the age of 25. And that's when it's actually at its full capacity. The amazing thing about our brain, as we already know, is that it is virtually unlimited. The capacity of our brain is virtually unlimited. It consists of 86 billion neurons. Information travels extremely fast. So I'm not going to give you that number as of yet because I'm going to share that more in another area. But information travels very fast, and a lot of people don't quite understand what that looks like. So today you're going to get an opportunity to truly see, hear, and understand what that looks like. And amazingly, if you've paid attention and didn't sleep in class, then you know that our brain generates 23 watts of power, and that's enough to light a light bulb. And so there's some amazing things about our brain that we are going to talk about today. And so first, I want us to focus on how does that brain develop? Okay, how does our brain develop? So we're going to first talk about the brain stem. The brain stem is the very first part of the brain to develop. To develop. It is a necessary conduit for all signals traveling from the body to the cerebellum to the cerebellum and vice versa. The brain stem starts, it is at the bottom and at the back end. If you look at your screen, in the back, so close to your spine, if you can see my arrow, that's where that stem is connecting to your brain, and it serves a massive duty to our body. The next part of our brain that is very important is the limbic system. Now, the limbic looks like an ear. If you kind of look at it, it's this little curvy part right here. It looks like an ear when you kind of look at it. The amazing part about the limbic system is that it carries two different functions, the amygdala and the hippocampus. And you're going to hear me talk a lot about that area. The amygdala, the hippocampus, and the frontal lobe are really going to be the primary areas. But the primary duty of the amygdala is a warning. Its job is to warn us. It's a smoke detector, and it's letting us know different things. It's regulating our emotions, our memories. It even can fall into that survival instinct. But the hippocampus, now that its job is to regulate our hormones. And so the amazing part of all of this, when we look at that limbic and the hippocampus, is they work simultaneously together, and they play a very important role when we go back and talk about um, how fast information travels in the brain. Those two play a very key part in that limbic system. The third part that we're going to focus on is our prefrontal cortex. That's the very front part of your brain. That's that forehead. Here we call that the watchtower or the executive brain. The watchtower, again, is that upper brain, the upper part of the brain, and it matures last, as we shared earlier. It is responsible for our ability to pause, to think, and to reflect, as well as concentrate, and operate in a problem solving mode. The prefrontal cortex and the amygdala work together to regulate both emotions and our behavior. Now, when the brain is impacted, this is a very important part. When you look at this image here on my left to your right, the healthy brain is very solid and round, which, anytime you looked at images on an MRI, a healthy brain is pretty well formed. But an unhealthy brain, as you can see on my right, your left, is the total opposite. I'm giving you a picture image, but later on I'm going to give you something much more tangible to get a better scope of it. But when you think about your brain, or when you're looking at your brain and the impact of it, when something traumatic happens to you or to I, we usually experience trauma through both the brain and the body. Traumatic brain injury usually results with a violent blow or jolt to the head or to the body. Mild traumatic brain injuries may affect the brain cells temporarily. Moderate to severe traumatic brain injuries can result in prolonged or permanent changes in a person's state of consciousness, their awareness, and or their responsiveness. Based on the Center for Disease Control and Prevention, they've shared that falls are the leading cause of brain injuries at about 47%, followed by um, followed by being hit or being thrust against an object. That's about 15%. Car crashes is at 14%. So now, what is trauma? Trauma is an emotional response to a terrible event like an accident, rape, or natural disaster. Immediately after the event, shock and denial are typical. Long-term reactions include unpredictable emotions, flashbacks, strained relationships, and even physical symptoms like headaches and nausea. Trauma changes the brain, and I'm going to show you this area in more detail, but I want to give you the backdrop of it as to how trauma changes the brain. First of all, as I shared earlier, when I stated that falls or a form of being thrust or tossed or pulled or pushed for a woman has a greater degree of impact to the brain than it does to men. One of the key things that we've learned, and now it's beginning to become more relevant than before, based on the study of football players to women impacted by in domestic violence due to the impact of forms of abuse. Now the of the research is showing how a woman is just from being slightly yanked in a sense, because due to the size of a woman's brain, she can incur a form of trauma. It could be something maybe small, and the and one of the trickiest things about it is she doesn't quite know. And so through all of the research, we're learning much more. But the um, key areas of a brain based on trauma has the potential of leading to post-traumatic stress disorder. One of the biggest things that you're looking at in here is that how the body changes. The cortisone, it will increase, and the neurotransmitters and the hormones are all over the place. And what this does as you are reading is it activate the amygdala. And I'm going to go more in detail. Everything I'm going to go more in detail about, and it's going to all kind of make sense when I show it to you physically. But the way that the brain is triggered, it basically is taking the person and and it has put them in a safety mode. And so when that safety mode has become breached, then everything that you're looking at here becomes activated. And then that's where you have the racy hearts, the fast speech. The mind is ruminating very, very quickly. The tensions in the muscles and the gland, all of these things become activated when there's a form of breach. And that is because of the way that the brain have a person that might have been a victim in that safety mode. And so these things are taking place inside at the time. And so this here, as we move forward, what you're looking at with those physical and emotional traumas is that 8% of Americans do suffer from PTSD and do not even know about it. One of my studies that was done centered on home women that were in a women's shelter due to domestic violence, and 80% of those that were in the shelter was documented as having a form of PTSD due to head trauma, and they did not even know it. And the sad part about this is that it does lead to other long-term health issues. And so those are the things that we try to make note of. Now, when emotional trauma impacts the brain, it leads to chronic stress, heightened fears, and increased irritation. And um, this is where you see individuals will shut down very easily. They close off. They isolate themselves. This is because of what is going on the inside, and it's very, very difficult for them to actually understand. And so they're trying to operate in their normalcy, but they are unable to. I'll go into more detail as that regarding that as well. Um, Now, when we look at our types of trauma, I'm quite certain you've heard of these, you've experienced these. Um, but the biggest thing I want you to know is that there are direct traumas and there are indirect traumas, direct and indirect. When you're looking at those that are on my left, your right, this is a form of direct, acute, chronic, and complex. Acute is more of a single accident. It may mean you might have a little issues, you might have a little flashback, but it doesn't stay there. But when we start getting into the chronic and the complex, this is something that's long term. Chronic is more of a repeated, and prolonged. Complex is multiple. You can think of complex more so like like military soldiers who are going to battle. That grows into our intense PTSD of complex trauma. Indirect is those that like working inside of your office. You can have forms of compassion fatigue, burnout, You can, the empathy, which is vicarious, you can live with it. Me, I suffer from secondhand trauma, and you're going to learn more about that. So if you've experienced any of these, or all of these, or some of these, all of this is due to what you might have been exposed to. The relationship between intimate partner violence and brain injury. There is a correlation when we look at this. Domestic and intimate partner violence are common cause of traumatic brain injury. While a disproportionate number of these individuals are adult women, both men and children can be victims of the severe violence that causes these injuries in a domestic setting. 1% or less victims are appropriately identified by healthcare systems. As many as 23 million women in the United States who have experienced intimate partner violence also live with brain injury. 30 to 74% of women with traumatic brain injuries are seen in the emergency room each year. 81 to 115% of patients report loss of consciousness at the time of the violence. Strangulation is another core issue that relates to domestic violence. One of the studies that we looked at in Pink Concussion is the factors of the nature of why, for women, why the attacker automatically goes for a woman's throat. Just a small portion of air that's cut off from the brain can cause forms of damage to the brain, and though we're going to go over those issues, or cause forms of symptoms. And so some of those symptoms you might have heard of, and others you may not. But when we look at strangulation, the biggest thing I want you to know is that strangulation, obstruction of blood vessels and or airflow to the neck and to the brain. 1 in 4 women will experience intimate partner violence. Of that, 68% will experience fatal strangulation by their partner. As we know, this what can occur within this area is loss of consciousness within the first 5 to 10 seconds, even leading to death. 97% of women are strangled manually with the hand, meaning with the hands. 38% reported, 35% also incur sexual assault. So these numbers are very alarming. And so with a lot of individuals, I don't know if you've heard, because I talk to a lot of individuals, when I talk with them and they report strangulation, the very first thing second thing that comes to me afterwards is, I'm okay. And so to that is when I will share this. I'll ask them certain questions, and these questions all center on their symptoms. And majority of the time, several of these are identified. And so it's important to know what these are. So if you are talking with a survivor, you to share with them what these symptoms are, such as their voice change, breathing, vision, behavior. By sharing these things, it helps those individuals to begin to make conscious decisions about what, about their future, what they should be doing, how they should be doing it as they move forward, meaning making healthy decisions about their relationship, if that is, healthy relationship or unhealthy relationship, and what that really looks like. Which if they are in any type of abuse or sexual relationship that is unhealthy, we really want them to make conscious decisions about getting out. What we do know is that, going back to statistics, is that a survivor will return up to 7 times. And so as I talk more about and show you this demonstration, I think it'll kind of open the door to help you to understand a little bit more. So before I prepare to close out my screen, I want you to take a look. I wanted to show you this particular diagram one more time because I'm going to tell you about my mom. And so the key areas that I want you to focus on are your prefrontal cortex, which is the front part of your brain, your amygdala, and your hippocampus. And so we're going to go into more of an applicable visual so you can see the nature of what that truly looks like as I talk with you and share more about my journey with my mom and the things that I experienced through secondhand trauma. So with that, I'm going to stop my screen share. Okay. And so I'm going to introduce you to my Brittany. Brittany and I go out and we talk. This is our mascot that I use when I'm talking to individuals. With youth, we use Brittany to help them to understand emotional regulations. With survivors, we use it based as to the slides that you just seen to give a more visual of what trauma looks like and how it is impacting the brain. So with that, I grew up in a small town in Alabama. And one of the most common things for me to see in our town was alcoholism and domestic violence. My mother and all of her friends every day I would see one of those taking place. Black eyes were very, very prevalent. During growing up in that type of environment, I never knew the nature of what was going on with my mom. My brother, sister, and I would our biggest thing was with my mom was just call her crazy. She's just crazy. Phyllis is just all out there. Phyllis is, and but as she spent her last days or all throughout my life and as she spent her last days, one of the things that was very, very consistent with my mom is that she would always tell me and my siblings I was a little girl on a farm with a bunch of men. And ladies and gentlemen, I don't know if any gentlemen are on here, but every time I heard that story would just go over my head, and I'll be like, "Oh, Phyllis just crazy. Phyllis just acting out." And at times I would try to talk to her about, quit drinking, not doing the things that she did, and why she did it. And as a little child, I didn't quite understand why she was doing that, and she would always say, "Susie, I'm trying," and Susie is my nickname. And she was like, "Susie, I'm trying to quit. I'm trying not to do this, or I'm trying not to do that." And I thought it was just her. Fast forwarding to my recent years in college, I'm sitting in a psychology class and we're going over the human behavior of a domestic violence victim. And the whole entire time I'm sitting there looking and listening to my professor and looking at all of the demographics, all of a sudden he started hitting areas that was triggering me. Those areas that he was triggering were images of my mom. I really didn't see the picture that was being presented. I see my mom. And I'm sitting there in shock, like a deer in headlights, trying to figure out, like, oh my gosh, in my mind, I'm going, oh my gosh, oh my gosh. And so my professor was like, Juanita, are you okay? And the only thing I could say is, yeah, I'm okay. But I wasn't okay. At that particular time, everything made sense to me. Everything. I began to truly understand the nature of what my mom was going through. I truly began to understand not just her, but women like her. And so when we began to put Rediscover Me together, the key part of that was I wanted to make certain that I provided something for survivors that would help them to understand, to have more of something more tangible, something more effective to understand what their body is going through and why their body is going through those things. And so what I want to take you back, like I said, to that amygdala. And so when you look at, as we shared in the diagram, the amygdala part of the brain is more of in the area of your lower brain. So you have like an upper brain. That's that big mass, the top part of your brain. That's your top brain. But in the lower part of your brain, That's where the amygdala is housed at. And so within the amygdala, remember I said I was triggered. And some of the things I've said here today, someone has probably been triggered as well. And so what happens is this. Inside of the amygdala, we call it two or three different things. It's either going to be the lizard brain or the we'll talk about the file cabinet or the librarian. So I'm going to use the file cabinet and the librarian here. So inside, which is that mental part of the area where your emotions are centered, which is the central part of your brain. That part is where that is regulating your that part. The center part of the brain is regulating your emotion. The file cabinet back in your amygdala, back part of your brain, is pulling out information. So basically, when something happened, when someone was triggered, or if you've seen something that related to you, your childhood, or someone that you're working with, something that you've been exposed to, then all of a sudden, what happened is the librarian went to your file cabinet and she started pulling out stuff. She started pulling out stuff. And so basically, put Brittany down, she was firing off information to you. It was going to your frontal lobe. So all of this stuff, all of that information, she pulled something out and she was like, is this it? Is that it? Is this it? Is that it? And so basically, as that file cabinet, as that information is going to your frontal lobe, it's shooting between 250 to 268 miles per hour. And it's like, and it's like, and it's coming real fast. So if a person, just think about the person as a survivor. If that information is coming real fast, so it's like they sent the first image and they were like able to regulate those emotions. Remember, in our middle brain, they were able to go to their coping mechanism, calm that first image down. But then but then there was no response. And so in that other safety mode, it's like, nope, that wasn't it. Let me send something else. So the file cabinet is just sitting in things. And so those emotions are not able to remain in that regulated state. So all of a sudden, what you're looking at is that person is going into that space that we talked about, the symptoms and all. It's like the everything inside of them, the muscles, the stress, the strain, the everything, the brain becomes, or the safety mode becomes breached. So so when we look at this as an example, when we look at this, so give you a visual, when a person is first victimized, the brain automatically goes into a safety mode. And so, if the person has not gotten counseling, if the person hasn't been with someone to help educate them on what their body is doing, then it's constantly kept that safety mode or that safety switch valve is stuck here. So when they go through other forms of traumas, then that's when you see them staying in a more of a closed natured space. And this is because the survivor is trying to regulate their emotions. They're trying to regulate all the information that's coming at them. They're trying to regulate what is safe and what isn't. So all of this is going on nonstop, firing off like laser. And so this is where you finally find someone that might be in a state of flipping out. If we use our hand model, it would be like they be in a safe mode, they be operating with their executive brain. But if too much information is coming too fast, then all of a sudden they're flipping their lid. They're flipping their lid. This is why my mom was spiraling out. This is why my brothers and sisters was calling her crazy, because in her protective mode, she was when she was able to be okay. But when her safety mode was breached, then all of a sudden she's cursing, she's drinking, she's screaming, she's going off on everyone. She's just very irregulated. And getting her to calm down was kind of difficult. So as that oldest child, it was like I was in the storm with her. I was in the fight with her. I was in those places. So I seen what she was dealing with. I understand now more what she was battling. And so when we look at that, so just imagine always being in that space, always be holding on, trying to keep yourself in that safety mode. So what does that look like? I have two demonstrations I want you to see. I was at the beach and I found these two rocks. So remember earlier when you looked at the healthy brain and the unhealthy brain. So if you could see, and I think you can, this rock has lots of glitter and it's kind of like with the little bumpiness of a brain. And I wanted you to have a full visual. So this is like my healthy brain. But when stress, when all the things that begin to take weight on the brain, then what you'll look at is the brain starts developing little tiny holes, little tiny crevices inside of it. And so just imagine your brain being in this type of space for a long period of time. Remember, if anything that is prolonged, ongoing, it leads into a form of complex or chronic PTSD. So individuals that are operating in this is a visual of what their brain is looking like, healthy versus unhealthy, and staying in this state, and why getting the necessary help is very important. Unfortunately, for my mom, I will say um that she never did get the help that she needed, as well as the women that came from our community. And each and every one of them that I know of that had, number one is that it due to the alcoholism, it led to other chronic health issues. My mother died of lung cancer. My sister also, who was a victim, she died of kidney failure. Other women died of breast cancer. So it led the issues that they suffered from led to other intense areas of chronic health issues. And so the core of Brittany and I is to make certain that we educate individuals on what this looks like, even down to the strangulation. Because what most individuals are not aware of is that when a person is strangled, majority of the time there is a thrashing. So that the weight of that woman's brain at 2.75, you know, it's it's being shifted. And so we want to make certain that we educate individuals on what that looked like, how that looked like. And so today, as we prepare to close out and open up this space for any questions that you may have, um, understand understanding the nature of the neuroscience as it plays to these areas of domestic violence and sexual assault are key factors in helping survivors to begin to understand what is going on with their body, number one, necessary actions they need to take, number two, and then the third part of it is being brave enough to ask questions. And as always, one of the biggest things that we look to do is to make every area that we are, every space that we walk into, a safe space where survivors have a place to talk, to be educated, and to learn more about what is happening and how it's happening and how they can create very healthy mechanism. Now, when we talk about healthy mechanisms, the biggest thing that I can share with you is that even though a person is dealing with um, with issues of an unhealthy brain, your brain can recover. The neurons can become rewired. But one of the things that an individual has to do is be very intentional about breathing. You'll hear me talk a lot about, which I don't do, but exercise. I do a lot of exercising, but I don't do a lot of yoga. Yoga is one of the key areas for helping to strengthen the brain because it deals with a lot of intense breathing. For me, I love to walk. I love to be out in nature, and I'm a very big advocate on exercising and walking outside in fresh air so that way my lungs are being strengthened, my brain is being strengthened. The other area that we have to be very intentional about educating survivors on is sleep. And a lot of us take that for granted because the biggest thing with the sleep patterns is if the brain is always in its safety mode, then they're not necessarily resting to the fullest capacity. One of the apps that I use and I recommend to everyone is called CBT-I, or Cognitive Behavior Therapy-I. This app was designed by the Department of Veterans Affairs. And so I recommend individuals to do 10 minutes at night before they go to bed, 10 minutes when they get up in the morning, 10 minutes at night, 10 minutes when they wake up. It's a free app. What is it? What it's doing is getting all of this oxygen to the top of your brain. And as it's getting the oxygen to the brain, it's calming all the systems down. And the biggest part of that and why it's so important is we want the person to get to that third stage of sleep. First stage, second stage, I can hear things that's going on. I can, I'm dreaming a lot. But that third stage is when you and I are, oblivious to everything that's going on and you get that full rest. And when you wake up in the morning, you're revitalized. That doesn't, you do not have to be a victim to take advantage of that just from the work that you do day in and day out. It's important to make certain that you are very conscious of the stress levels that are on your brain, and how your muscles are weighed down and how they're tensed, and even down to what your breathing patterns are looking like. So even though I'm saying sharing this from a place of domestic violence, this and all the things that I've shared goes all the way across the board to anyone that has been impacted by trauma. And so with that, I'm going to um, close out. And I want to just again say thank you for allowing me to share. And I pray that what I've shared today is impactful and that it helped you to be able to support someone else as you move forward. I'm Dr. Juanita McDonald with Rediscover Me. Thank you very much for the opportunity.
Thank you so much. That was fantastic. A lot of great information. Y'all, please feel free to ask questions. There are 15 minutes left. You are welcome to put something into the chat if you didn't want to unmute yourself. But either way, I figure there probably were some good questions looming out there. So please go ahead. Looks like Gloria asked if you could please repeat the name of the app.
Yes, and I'll put it in the chat as well. It's CBT-I, which is Cognitive Behavior Therapy-I. It's free in your phone app.
I don't have a question. It's just more of a statement. This was awesome. Thank you, thank you, thank you, Dr. McDonald. I wish I had known some of this a few years ago because I did work with someone and I suspected that they had experienced themselves or directly or indirectly being a part of a family, some abuse. And things that you said were some typical behaviors, some of the typical behaviors that I saw in that person. And I think I could have been a bit more understanding and empathetic had I had a better understanding of some of the effects of domestic abuse. So I thank you for this. And hopefully, if I ever have that experience again, my response would be different towards, it would be different.
Absolutely. That's what I look at every day. And I'll also share my last advocacy training in Florida. We worked with a bunch of men, and yes, ma'am. We worked with a bunch of men who were advocates, and from their duty station, and each of them, and it was the first time that I worked with male advocates. I'm always working with female advocates, and to see the nature of them understanding what that brain looks like and how things are happening, they were able to equate it to their own personal life as well as what that looked like with certain family members. One person did share how he had just kind of cut his family member off, but then once he learned more about um, what we were teaching, from that holistic perspective, then he began to understand that it was like, wow, I should have been approaching him totally different. And I'm like, yeah, but we all don't know everything, and I don't know everything. Every day, I'm also looking to try to see what else is out there. Um, that we can bring back and share with individuals such as yourself as well. So we're going to all help as many people as we can. So thank you um, for taking some information and being able to use it. Yes, I'll share that contact information.
I see another question, and I think you may have answered this. Dr. Paisley, if I'm saying your name correctly, wants to know, do you work with veterans?
I have not worked with specifically with veterans, Dr. Paisley. When I say that, I'm referring to someone within domestic violence. I have not per se. I do work with a lot of military wives. That seems to be the area that my shoulder is tapped on. Majority of the time, dealing with divorce, dealing with some traumas in that area. So I've worked from there. But I do work with men. So I've worked with three men so far, and they have made massive changes as well based on our program.
Yeah, the reason that I'm asking that is I'm retired. I worked with the VA. I also worked with Fort Jackson with their victim advocacy program before. And now, I'm a nurse and I'm also a therapist. And so one of the things that I've been seeing is that, and I'm glad you work with the spouses, because a lot of times, because they don't understand what's going on with post-traumatic stress and those other traumas, they basically trigger them by just trying to make them get well, like wave a wand now. And it's more of a trigger. And then, my concern is with some of the people that I worked with is now you're being victimized secondary also, because when you trigger a vet that's off the chain, you get a whole lot of drama within the home, which affects everybody, the spouses, the kids, everybody. So I just need your contact information.
Absolutely. Thank you so much. Yes, it does expand, uh, and I think I kind of cringe, Dr. Paisley, especially when, like now I'm working on this study of how it impacts infants. And so, when you look at the nature of even how an infant, a lot of times family members was like, well, the baby isn't impacted. And I'm like, oh no, the baby is impacted as well. And you don't see it immediately, but based on study, by that 4-year-old range, then you're seeing infants acting out. And it's a tall tale to what has happened. And that's more so because they as an infant, they weren't able to express themselves and didn't understand what was happening. And so their nature was to scream and to cry. And so in the midst of doing that, guess what it was doing? It was programming, because this is a gigantic computer. And so that was being programmed. And so the very first impact that would take place, as you are aware, to any type of traumatic situation would be to scream, to do exactly what it did to comfort itself from that perspective. So yes, absolutely. Anyone else? All right, hearing none. Thank you so much again for allowing me to share this afternoon.
Yeah, huge thank you. I definitely see lots of thank yous in the chat as well for you, Dr. McDonald. This was fantastic. Tons of great information. A great kickoff to the handful of virtual sessions that we're offering with the Public Health Association. So looks like you put your contact information in the chat. So y'all please take that down. Get in touch if you think of any future collabs and questions and things you have. Shout out to Patricia and to Kathy for helping to organize this for the Public Health Association. This was such great information, such an important topic. And if you're able to, look out for the emails. We do have a couple more coming up on Monday, and one is an advocacy legislation policy chat with the panel at noon, and the other one is at 1:30, and it's discussing around opioids and Narcan, and that's with the contact with DHEC. So would love for y'all to participate in those as well. So huge thank you to everybody. And if there are no last questions or comments, we'll conclude. I appreciate everybody's participation so much.